Hello, everybody, on this glorious, absolutely glorious fall day. I'm looking out at my backyard with the dappled sun coming through all of the leaves, and it's very, very beautiful. Um, so we're so looking forward to this talk on integrative medicine and older adults. It's going to be given by Dr. Julia Loewenthal, one of our geriatrician colleagues in town. And it's a wonderful topic. We haven't had that. We've had one talk on this, but I think this is going to be a wonderful opportunity to find out what this is about, how it can pertain to us. And I'm going to let Matt introduce Dr. Loewenthal and give any kind of quick updates about getting onto our show today. And then we'll really look forward to all of your questions that hopefully Dr. Loewenthal can answer. So Matt, take it away.
Great. Thank you so much. Good afternoon, everyone. I'm the substitute in for Susan Edgman-Levitan, who can't be here today. So I'll be the moderator. I am one of the doctors here in the Geriatric Medicine Clinic, and I'm the clinical director of geriatrics here at Mass General. Just as a reminder, we'd like you to, everyone is muted so that the speaker can speak uninterrupted. We have your pre-submitted questions, and you are free to submit questions in the chat function. As a reminder, please do not put any personal health information as that we can all see it. And you probably don't want the world knowing all of your business. So just keep that in mind. I'm going to now introduce Dr. Julia Loewenthal, one of our colleagues over at Brigham and Women's Hospital. She is an instructor in medicine at Harvard Medical School and a geriatrician at Brigham and Women's Hospital. She completed the Harvard Multi-Campus Geriatrics Fellowship and trained in internal medicine residency at the Brigham. In addition, she is a graduate of the 200-hour yoga teacher training at Down Under Yoga in Boston. Her clinical and research interests center on the role of mind-body therapies for healthy aging. She is the author of a recent systematic review, The Effect of Yoga on Frailty, for which she won the Annals of Internal Medicine Early Career Investigator Award. She is also the recipient of a HRSA Geriatric Academic Career Award. Let's welcome Dr. Loewenthal, and we're excited to hear your talk.
Thank you. And thanks to Matt and Sharon, who I've benefited from in training over the years. So it's really an honor to be invited to speak to you all today. So I am going to go over the area called integrative aging, which is kind of an emerging area of combining the best of geriatric medicine and integrative medicine. And so our objective today is to really define integrative medicine and health, introduce some definitions of healthy aging, and then I'll go over some more specific applications of different clinical tools for healthy aging, including things drawing from mind-body therapies, movement, dietary patterns, and others. So kind of a peppering of different things towards the end. So this is one of my favorite pictures. This is a yoga instructor named Tao Porchon Lynch. So she died in February 2020 at the age of 101. But she was practicing and teaching yoga really till the end of her life. And you can see here she's in a full lotus position and is hovering 2 inches off the floor there. So just an incredible picture of strength and flexibility and health as she's gotten older. On the other hand, we also think about this person who is someone I'm more familiar with in my clinical practice. So this is an older woman who's sitting in a wheelchair. So would we consider this healthy? Well, she's out in the community. She needs some help from a wheelchair. She needs support of a caregiver, but she's engaging with the social world around her. And so, I think as geriatricians, we very much would consider this still part of health. It's just thinking about how we define the concept of healthy aging. So we're in medicine, we're used to this sort of traditional biomedical approach, which is breaking down health into different organ systems. This is very worthwhile. It's cured a lot of diseases, helped us manage, cancer and heart disease in new ways. But as geriatricians, I think we appreciate that all of these organ systems, when we think about them separately in silos, they can produce guidelines that conflict with each other. They can lead to people taking a lot of medications that might have side effects or interact with one another. So there's a really, I think, I see this a lot with patients, a call for more of a holistic approach. And that's what I think comes from with geriatric medicine, and then also integrative medicine, which I'm hoping to introduce a little bit more today. So thinking about this concept of successful aging, there's a variety of different definitions. This is sort of a widely known definition from these researchers, Rowe and Kahn. So they define successful aging as really the intersection of avoiding disease, engaging with life, and maintaining high cognitive and physical function. The WHO has also put forth a model that is a little bit more complex and takes into account different environmental factors, different personal factors, and really thinks about the person's ability to participate in activity, even if it requires, substantial support from caregivers or devices or for other reasons. So just some food for thought about healthy aging. This was a definition our group published related, we framed it for COVID-19, but really thinking about optimizing all these different domains of health, like cognitive health, physical health, mental health, really getting that social engagement, and then also trying to prevent chronic disease and injury. And then another way to think about this, I'm going to start transitioning into integrative medicine, but a nice way to thinking about integrative medicine is how we bolster people's resilience. And frailty is another way to think about this in geriatrics, where a person who has what we call a robust state of health in the green line might have a little bit of a setback when they get a minor illness, but they recover quickly back to their baseline. And then somebody who is frail, represented here in the red line, has a larger setback and then takes a longer amount of time to recover, and they might not get back to their original baseline. And so when we do our geriatric assessments, we look for frailty as a way to think about holistic health. And so we know that frailty is not really the norm for our patients. It's present in a small proportion of adults who live in the community, but it does increase with age. And we see it especially in our patients who live in nursing home facilities. But we know that most older people do not live with frailty. So another way to think about frailty is also from this angle of resilience and how do we support people's strengths. So these are two models of a suspension bridge. And this is, we can think about patients if they have a major illness, like for example, cancer, and it's taking out one of the supports of the bridges. That is really bringing, we are bringing in more from the organ-based medical disease perspective and trying to treat the cancer, also thinking about the whole body, trying to support them in their recovery through nutrition and physical activity. But we also have patients who don't have a single major disease, and they might have other chronic illnesses that have accumulated over the years. They might have some muscle weakness. They might have hearing loss, vision loss. And so they accumulate lots of little minor stressors over time. And so it's also really important to think about how to support these patients, which this might come, the sort of holistic framework might come in to be even more helpful in this second case. This is just another example of how we do our assessments and think about different vulnerabilities in different domains. This is a nice figure from one of our colleagues, Day Kim, over at the Beth Israel Deaconess. And so we think about this when we do our geriatric assessments and try to target our interventions to these different areas. And really the goal of not only geriatric medicine, but also integrative medicine is to think about how do we build people's resilience back up so they can try to approach this green line again and have a better recovery process that gets them close to their baseline again. So I'll talk about, there hasn't been a lot of work in this area thinking about integrative medicine for this purpose, but I'll talk about some of the kind of emerging work here. But first, just a definition. So the National Center for Complementary and Integrative Health, or the NCCIH, which is the National Institutes of Health branch that covers this area, defines complementary approaches as those that may have originated outside of conventional Western medicine. And so the term integrative healthcare is really bringing in both the conventional kind of Western organ-based approaches and complementary approaches in a safe and coordinated way. So really the emphasis is on a holistic, patient-focused approach to healthcare and wellness. And you might have practices that come in from physical approaches, psychological approaches, dietary approaches, and they often target multiple systems all at once. And there's also this term alternative medicine, which is not used as much anymore because we know, so alternative medicine refers to people that use non-conventional healthcare practices in place of conventional medicine. And we know that most patients use practices from both conventional medicine and other areas. And so that's why this term integrative healthcare is used more often these days. So integrative medicine is divided roughly into these 4 buckets. So there's this bucket 1 of dietary supplements, which may include vitamins. It might include herbal medicine like ashwagandha, for example. It might include other like homeopathic regimens like non-herbal, non-vitamin supplements. The second bucket includes things like mind-body practices, so Tai Chi, Qigong, yoga, meditation. Manual therapies may include chiropractic care, acupuncture, massage, and then traditional medicine systems like Ayurveda and traditional Chinese medicine are considered as part of a 4th bucket, but they may include aspects from other approaches seen here. So this is just a rough way to categorize the different modalities. I'm not going to be able to touch on everything in this talk, but I'll go over a few different examples of how we might think about different integrative modalities for older adult health in particular. So Tai Chi is a movement-based mind-body therapy that includes these sort of slow dynamic motions adapted from martial arts, and often includes a lot of imagery from nature. So you might in a Tai Chi class think about rooting down through your legs like a root system in a tree, or moving your hands like clouds or the wind. So there's a lot of mental imagery that's evoked in Tai Chi. And so from the sort of Western medical research perspective, it's considered to be very well studied. So this data is drawn from Cochrane reviews, which are sort of high quality research reviews. So there's evidence that Tai Chi improves balance in Parkinson's disease, reduces fear of falling, and can reduce pain due to knee osteoarthritis. In addition, it's often incorporated in a lot of cardiac rehab programs. So patients with heart failure, it can improve quality of life, and also patients with cancer. So I think in my clinical practice, I'm often talking about Tai Chi from the perspective of fall prevention, and especially reducing that fear of falling and helping people's sense of balance and coordination to improve. And so yoga is another example of a mind-body practice that includes physical postures, but also breathing practices, meditation, and they also can include other elements like different ethical or lifestyle practices. So this is just a synthesis of different reviews and different conditions that yoga practice can really enhance overall self-reported health, cardiovascular risk factors, including type 2 diabetes, lung function, cognition and mental health, stress and mood, balance and mobility, and also quality of life. And this was, so the review that Matt mentioned in the introduction, we published back in March. So we looked at this sort of overall concept of frailty and found that yoga especially could help with things like lower body strength, so the ability to get up and down from a chair, and also walking speed. So acupuncture is a practice that comes from traditional Chinese medicine. It includes needles that are placed at what are called meridians, where there are these lines of energy flow in the body. I don't profess to be an expert in acupuncture, so I'm just going to touch on this briefly, but there is some nice evidence that it can help improve chronic low back and neck pain, and also the pain from knee osteoarthritis. And also can help with migraine and tension headaches, which I see a lot in my practice, is that it can be very helpful for patients with headaches. And in general, a guideline is that people typically need about 6 to 8 sessions to start seeing a clinical benefit. So if you do try acupuncture, it's good to try to commit to trying it weekly for a period of time and not just do one session. And then chiropractic care is a modality that it's called a manual therapy. So chiropractors practice things like spinal manipulation, but they also do soft tissue massage. They might look at your ergonomics, so how you're working at home and at work in terms of your body position and posture. They might prescribe exercises kind of similar to physical therapy, where you're working on specific strength and mobility practices. So they have a lot. I think we think about them a lot kind of from the lay perspective as doing a lot of like cracking of the back and the neck, but they do a lot more than just the spinal manipulation practice. And there's some nice evidence that it can help for acute and subacute low back pain, neck pain. And then, I have a lot of older patients who have scoliosis and other sort of asymmetries in their shoulders and back. And I find that chiropractic care can be really helpful for those conditions too. And there was an American College of Physicians guideline in 2017 that really highlights the potential importance of a lot of these practices for the management of acute and chronic low back pain. So you can see that there's low quality evidence, but a strong recommendation to use things like massage, acupuncture, and spinal manipulation or chiropractic care when someone's coming in with acute or chronic low back pain. Okay, and so I'm going to switch gears a little bit to just touch on a couple other areas too. So diets to promote healthy aging. I get a lot of questions in my practice about dietary supplements, and I like to always try to pull back to the bigger picture of what's going on with the overall diet and nutrition. So I'm going to talk about a couple of different dietary patterns that have been studied to promote a healthy aging trajectory. And then I will intentionally only spend a little bit of time on dietary supplements because it's such a small part of people's overall health. So the Mediterranean diet is the pattern that's really most well studied in terms of supporting healthy aging. So there's this concept of a healthy aging trajectory that was defined by researchers, and they looked at the Mediterranean diet, and it improved the sort of healthy aging score in a cohort of patients. It's also known to lower risk of cardiovascular disease and stroke, and also reduces cognitive decline and potentially reduces new cases of frailty. So this is a much smaller study than some of these above. So less data here, but pretty good evidence, when we're thinking about cardiovascular disease and stroke, especially. And there are some other diets that have been looked at for healthy aging patterns. So There's something called the DASH diet, which is dietary approaches to stop hypertension. And that's been combined with the Mediterranean diet to produce something called the MIND diet, which you may have heard a lot about. In the MIND diet, there is some evidence that it can help prevent cognitive decline, but there was a recent larger randomized controlled trial in the New England Journal where there was no difference between the groups. So still a little bit unclear on how the MIND diet impacts brain health, but it seems to be, still pretty consistent that a Mediterranean diet pattern in general can help reduce cardiovascular disease and then potentially cognitive decline. And then the Okinawan diet is something that is described in the blue zones. And so the blue zones, we were actually just talking before we started the seminar. The blue zones are these areas in the world where they have a really high rate of centenarians, or people who live to be over 100 and are free of a lot of chronic diseases like heart disease, Alzheimer's disease, diabetes, and other chronic diseases. So one of the blue zones is in Okinawa, Japan, and then there are others in Sardinia, in Greece, in Loma Linda, California, and Costa Rica. And there's actually a new Netflix series on the blue zones that I encourage everybody to watch, because it gives a good overview of a lot of these concepts. But one of this Okinawan diet that's described in the blue zones is interestingly largely based on sweet potatoes and other carbohydrates, and also includes things like seaweed, other whole grains, a little bit of fish, but it's kind of an interesting one. It's a little bit different from the Mediterranean style and the DASH diet, but seems to be very correlated with a healthy aging pattern, at least in this area of the world. So just wanted to put that out there for a little bit of food for thought. And in general, I think sometimes it can be overwhelming to think about diet and dietary patterns, because if I had to eat sweet potatoes 2/3 of the time, that would not be my preferred eating style. So when I try to encourage people to think about how this fits in your life, and so in general, we want to eat a variety of different types of foods. We want to try to prioritize fresh vegetables and fruits, although canned and frozen are also very, they're great and they're very nutritious. We want to try to eat about a handful of nuts every day, fish a couple times a week if we like it. We want to try to pick healthy fats and oils when we can, so especially olive oil. And then we really want to limit things like meats, especially red meats, butter and margarine, cheese, sweets, and fried foods. So those should be sort of special foods for most of us. And this is a nice this is called My Plate, and so this is a My Plate that's designed specifically for older adults, and it can give you an idea at a single meal when you sit down about how much of each food should be on the plate. So I think really just going back to the basics here and kind of considering these core principles is the main point of all of this. And then I'll also touch a little bit on dietary supplements as well. I get lots and lots of questions about this. So in general, we hope that people are getting most of their nutrients from their diet. There's, I think expecting to be able to get a lot from a pill is not realistic in terms of dietary nutrients. That being said, we know that older people are at risk for certain nutritional deficiencies. So when we think about macronutrients, a lot of times we see that people aren't getting enough protein, fiber, or fluids. And so that's really going back to what we put on our plate. We can't really get these macronutrients in a supplement form. So this is all coming from food. For micronutrients, we often see that older adults are deficient in vitamin D, calcium, and magnesium. So those are really sort of the top three when you look at the nutritional data. And then maybe for some people, vitamin B12, iron, and vitamin E. And this is something you can talk to your doctor about. And there are certain nutrients they can check on labs. They might ask you some questions to figure out how much of what the different micronutrients you're eating. So this is something where, you still want to talk to your doctor about it and get a detailed recommendation for you on how much you should be getting from a supplement. A lot of people will ask, can't I just take a multivitamin? Because I think I could get, hopefully I could get, maybe I don't know if I'm deficient in these micronutrients and I could just get them all in one pill. So in general, most multivitamins contain about 50 to 150% of what's called the RDA for vitamins. So they do contain, so sometimes they don't contain all of what you need. Sometimes they do have too much, but in general, they're in this sort of good target range. Many also contain minerals, but they might be below the recommended daily value. So for example, for older women, we should get about 1,200 milligrams of calcium in our diet. And then if we're not getting it in the diet, we can take it from a supplement. So most multivitamins don't contain all of the 1,200 milligrams of calcium. So this is why I always say it's good to talk to your clinician or your doctor about exactly what you need, because it might vary from somebody else. And most experts would agree that a healthy adult living in the community with a reasonable diet does not need to take a multivitamin, but older adults, again, are sort of highlighted as a group that might benefit from a multivitamin. So one thing we always watch out for as geriatricians is this concept of polypharmacy, which is taking 5 or more, or especially 10 or more medications, which can increase adverse outcomes in certain situations. So that being said, I think it's really an individualized choice with your clinician on whether to take a multivitamin, but some people may benefit from it if they're not getting enough from their diet. And then if you are looking to choose a dietary supplement, I just usually give a few general guidelines. So one is just to check out the NCCIH website, which I mentioned earlier on in the presentation, has a really good sort of database of different resources and handouts on different topics in integrative medicine, including dietary supplements. There's also, there is something called the Natural Medicines database that is a little tough to access for the public, but can be useful. And then consumerlab.com provides independent test results and information for consumers. So they do third-party testing of lots of different vitamins and supplements, and they give a nice report that has a lot of detailed information about the quality of the supplement and also the cost. And then I always say, just make sure to inform your clinicians about what you're taking. If you have kidney disease, there are certain, changes you might need to make to your supplementation. So it's always just really important to share this information with your team. And I also like to point out that higher cost does not indicate quality. So this is really well highlighted on the Consumer Lab website. And we, encourage you to get familiar with reading labels. There are some other markers that can help you sort of judge quality. So the USP label here, and then Consumer Lab also has a label. And then I always like to share too that natural doesn't carry any specific meaning. So organic does have specific meaning when we think about foods and other products that are labeled, but natural doesn't have any backing behind it. So I always like to share that as well. Okay, so I will stop talking because I think we're at the 30-minute mark, and leave time for discussion and questions.
Thank you so much, Dr. Loewenthal. Folks, feel free to put your questions in the chat function. We do have one question out there. One thing that patients will often ask about is, well, how much protein or how much carbohydrate should I take? And I always like to say, the 3-2-4-4, which is the thing from my childhood about how we used to do nutrition. But how do you advise patients on their protein intake? And do you recommend things like protein supplements or added protein powder?
Yeah, it's a good question. I mean, if we're able to, I like to have people meet with a nutritionist just so we can get some more accurate assessment. That being said, Medicare only covers nutrition consults for diabetes and chronic kidney disease. So it can be really tough to get a nutrition consult through Medicare. So usually we look for having a protein hopefully people are eating 3 meals a day and getting protein there. So I usually just, ask what a lot of people are doing chicken or egg or, beef, things like that. Beans and lentils are really good sources of protein. So, and then we might be, so there are different calculators where we can estimate the number of grams they're getting. And then there are some different weight-based protein amounts that we can calculate. So if people are frail, sometimes I will actually calculate out their protein needs. And then if they're not getting that, we might add like a nutritional shake. And we want to try to give those between meals so that people aren't getting full before they try to eat some real food. So that's usually my initial approach to that question.
Thank you so much. That's right. We also recommend sometimes giving Magic Cup ice cream, which is for folks who get very full on the liquid from the shakes. This is a protein fortified ice cream that can be bought on Amazon. I assume they ship it in a frozen container, and otherwise it would be melting on your stoop. I have a question here. Do multivitamins really help to maximize vitamins you may not be getting in everyday foods?
They can, yes. So I would say talk to your clinician about what you need, because I know, like, if people have kidney disease, you don't want to overdo it on the magnesium and calcium. There's just so many individual circumstances. So I would always just bring in the bottle, and then you guys can look at the label together, because a lot of multivitamins have only like 400 units of vitamin D, and you might need to take 1,000 units of vitamin D. So there's so many individual circumstances that I think it's just good to bring the bottle in and actually just go over it together.
Thank you. We have a lot of people who will hear about supplements and will get the endorsements of friends who take it, and then they can often be very expensive and not proven effective. And so I love the idea of just checking in before you make the major investment. We like a pill in this country. There's no denying it, but it's rare that that's going to be the answer. And I think and there's all these like powders and different drinks that are sold now, and I find there's a lot of financial scams going on, especially with supplements, and also things like knee braces, and people get set up for these recurring subscriptions accidentally. So I usually if I'm thinking, I always ask about financial scams and vulnerability, but that's an important part of it, is thinking about the vitamin world in this. Yeah, thank you. And then there's a question here about, we often will tell people you have to exercise more, but mobility might be a challenge. I might have a sore back and I can't stand for a long period of time. What do you recommend as alternative exercises?
Yeah, so the recommendations for exercise are to get aerobic exercise 150 minutes a week, which is like 30 minutes 5 times a week. And so that can be met with walking for a lot of older people. That being said, there's also a very specific recommendation to do some sort of weight training and balance training about 2 days a week each. So I always, like, if people haven't been exercising and if they have some pain or other limitations, I usually start them with physical therapy to kind of get back into exercise. And then they might transition to a group class through a senior center or a studio or, other means. Or some people do a personal trainer if they can, that's very expensive, but that's something that some people do. And then, I do think Tai Chi and yoga can be really good entry points into exercise too, because they generally are less focused on the sort of physical exertion aspect. So that can be, and there's a lot more focus on how you feel and your breathing and your state of mind. So that can also be a good, entry point back into exercise. But if like pain and standing are limiting, I would start with physical therapy personally.
Thank you. We often will have, there is, for those who don't know about the AARP program, originally out of Cornell, seniorplanet.org, they have Monday through Friday, like Zoom-based meetings like this, which are exercise classes, and they're free, and they are at whatever level of function, they sort of meet you there. Don't forget about things like chair yoga. One thing that is great is there's a gym chain out there called Planet Fitness, which actually has started to put in hand ergometers, so hand movement exercises rather than the treadmill or the bike where people might feel scared of falling or something like that. This can be a great way to get that cardio activity, and you're seated comfortably when you're doing it.
Yeah, I have a patient who, like, you also might have to adjust your idea of exercise. So I have a patient who kind of returned to exercise after 10 years of really not doing much. And she's working out at the JCC in their classes, but so she used to use hand weights, but it's honestly, it was too much for her. So she just does body weight, and she does a sort of an open fist, and that's her bicep workout. And for her, it was a big adjustment because she really felt she should be using heavier weights, but she's just having to start all over again and kind of get to know her body again. And so sometimes just the expectations about what it's going to look like will also have to shift.
Excellent. Thank you. We have a question just about sort of the payment for holistic or alternative treatments. And can you tell us a little bit about what Medicare might or might not cover?
Yes. So the physician consults are covered. So like if you went to the Benson Henry Institute for Mind Body Medicine at MGH or our Brigham Osher Center, the physician intake consult is covered by Medicare. The chiropractic care is also covered by Medicare. So that's something a lot of people don't know. But the seeing a chiropractor, similar to seeing a physical therapist, is covered by Medicare. So certain Medicare Advantage plans also cover things like Tai Chi or yoga through a Silver Sneakers program. So if you have an Advantage plan, it's worth looking at that. Acupuncture is generally not covered. It's often covered by private insurance now. So like the MGB health plan covers a certain number of sessions. Mass Health covers a certain number of sessions per year. The Blue Cross Blue Shield covers some. So it's good to look, like if you have a secondary insurance, it might have some coverage of that as well. Massage and craniosacral therapy are not covered by insurance.
Thank you. That's really great to know.
Yeah.
I know that in Canada, as part of your health insurance or health program, you get a massage every month covered by your insurance.
Oh my gosh.
Time to establish a residency up there for at least once a month. I think this is a great question that someone is asking. Is there an age or point at which there are realistically diminished effects from all these terrific ideas? And I'll just preface that by saying one of the tenets of geriatrics is that sometimes people count themselves out before they actually should. And so our job can be to get them back in the game. So I'm delighted to hear your answer to this question.
Yeah, I mean, it's interesting. Like from the research, I looked at this a lot for the review we wrote from the research perspective. So in that like exercise, so I guess first to say there's not a lot of research about this to start out with. In the exercise world, you actually see that, so people who are frail, they actually gain more from exercise than people who are not frail. So they have like a bigger change than people who are robust or not frail. So they actually have, and you know, there's more to lose. Like if you're frail and you have a fall, you're more likely to have a decline in your function or your ability to care for yourself. And so you also have higher stakes. So I think it really says to us that, at least for the movement-based practices, that they are still really good, even if you're quite frail. Now, that being said, like if you, let's say you have metastatic cancer and you're on cancer treatment and you're very fatigued, it really needs to be taken into context of what's going on with you health-wise at the moment. But in general, at least the movement-based and the mind-body practices seem to be really good, even if you're quite older, like quite a bit older and frail.
I apologize, the mailman. So I think one thing that we took away from this is the use of, if I see someone in my family starting to get a little more frail, rather than jumping right to going to an exercise class, it might actually make sense to be evaluated either by your doctor or ask your doctor for a physical therapist referral.
Yeah, that, like, on a practical level, that's what I would do. There are these really nice programs that have been designed where you do like you only exercise 15 to 30 minutes and you do it every day. And so it's like a low level but frequent exercise regimen. And that seems to be quite good for frail people. But I think, like, on a practical level, just knowing what to do, how much to do, getting to know your body, I think it is really good to work with a physical therapist if you can.
And sometimes when we talk about this in geriatrics and we say, well, frailty is part of your story, patients will often get in their mind that this is destination, that this is the way it's going to be, and there's nothing we can do. And so that ability to really engage people around it and say, yes, you're feeling exhausted, you're feeling fatigued, and you're not doing a lot, we actually need to get you up and moving. That's a lot of motivation that we try and do in geriatrics. And we don't see frailty as sort of, this is your destination.
Yeah, and I think it's thinking about the environment you're in too, is there a way to promote frequent movement during the day? Like, a lot of these blue zones, one of the reasons people are doing so well is they have like a small town or a village that's very walkable and has lots of hills that has kept them very, in really good shape over the years. So if there's little ways to think about how you can just move around more in your day to day, and you're not doing like formal exercise, but you're just lifting stuff and like moving throughout the day, that's also important to think about.
Great. Excellent. Let me see if I've done. I said, Fred, you said time to bring health insurance coverage to Massachusetts, to heck with Canada. You're absolutely right. Let's sign that petition. We can get going on that. I want to thank Dr. Loewenthal for your fabulous content today and the really great questions that everybody has asked. And I really look forward to hearing feedback from folks about this. And as always, let us know what else you want us to talk about as we're doing these programs. We've really had such a great a list of topics, and we want to keep that going. So any parting words, Julia or Sharon?
No, just thank you so much for the invitation.
Also, can you hear me? Can you hear me? I worked at Boston Medical Center for many years, which is in the South End, and there were wonderful spontaneous Tai Chi classes in Blackstone Square every day. Except for when there was snow on the ground. And when you go to a park, sometimes you see classes going on that are like this, and there's no reason, and there's no age reason, unless you have some disabilities that would limit you to join these classes. And I think it's It's really fun to do this. I was in Central Park in New York not too long ago, and I was astounded by the number of classes that were going on the Big Green and the Sheep Meadow. I think you can, this is free, totally free. Someone puts out a boombox or somebody puts out music and somebody teaches. And I think, not, you have to not hurt yourself and you have to make sure that somebody knows what they're doing. But, in town here, there are places to do this. I thought, Juliet, maybe you can comment on how much it costs for people to, join a yoga studio or learn how to do a series of Tai Chi classes. If I've done it myself, but a very long time ago, so I have no idea how much it costs now.
Yeah, so the Tai Chi, so through senior centers, there is often Tai Chi and chair yoga, and those would be free. There are also a lot of YouTube videos that are free that are very good quality. If you join a private studio that's in Boston, it's very expensive. So the going rate for yoga classes these days is anywhere between $20 to $30 a class. So that can be super expensive. So I think I would check out the senior center as a good place to start. And then if you get really into it, you could look at, there's a body and brain yoga and Tai Chi, and then also the Tai Chi Tree of Life studio. So those are some that you could check out too.
And this is Judy. I put it into the chat, but from MGH, our Dementia Care Collaborative offers free classes, exercise and ageless grace. And then monthly, we have health and resiliency. And all of these kinds of programs are free and open to everyone, even if you do not have dementia or memory problems or challenges, or if you're even not a caregiver. So please join us. They're online and they're free and they're accessible to all of you.
Well, thank you so much. Now, I hope everyone gets out and gets that vitamin D therapy so they don't need to take as much medicine today, and enjoy the weather. And we'll see you again in a month. I don't know if our next topic has been decided yet. Has it? Nope. So stay tuned. I can't even do a cliffhanger. Stay well. Bye, folks.